Next, informed consent and data use policy. Introduction. Informed consent and data use policies are foundational to respecting patients' autonomy, ensuring transparency, and complying with legal requirements in health informatics. Clear policies and practices help maintain trust between patients and healthcare providers while supporting ethical data handling. Next, informed consent in health data, definition and importance. It is a process by which patients are informed about how their health data will be collected, used, stored, and shared. It ensures that patients voluntarily agree to these uses, respecting their autonomy. Next, key elements of valid consent. These include clear explanation of what data will be collected and for what purposes, and information about potential risks, benefits, and data sharing partners. Patients' capacity to understand and voluntarily agree, and right to withdraw consent at any time. Next, types of consent. Explicit consent. It is a direct, explicit agreement for specific data uses, and it's common for research. Next, implicit consent. It's an assumed consent based on patient's actions, such as using a hospital service. Next, dynamic consent. It's an ongoing granular consent management, allowing patient to modify their choices over time. Next, challenges. Ensuring patients fully understand complex data uses, managing consent for secondary data uses and large data sets, and updating consents as policies or data practices evolve. Next, data use policy. Purpose of data use policies: to define how health information can be used within an organization legally and ethically, and to ensure consistent practices aligned with legal standards and ethical principles. Next, key components of data use policies: scope. This includes types of data covered and permitted uses, such as clinical care, research, and billing. Next, access control. This includes who can view, modify data, and under what circumstances. Next, data sharing. This includes conditions under which data can be shared with third parties. Next, security measures. These are protocols for protecting data confidentiality and integrity. Next, patient rights, such as rights to access, amend, and control their data. Next, implementing and enforcing policies. These include regular staff training on policies and ethical considerations, auditing and monitoring access and data use, and clear procedures for handling breaches or unapproved data disclosures. Next, transparency and accountability. This includes informing patients about data collection and use practices, providing accessible privacy notices and consent forms, and maintaining logs and documentation for compliance verification. Next, ethical and legal interplay. Ethical practices support compliance with legal requirements and reinforce patients' trust. Clear consent and policies help organizations navigate complex data sharing and secondary uses, such as research. In summary, informed consent and well defined data use policies are essential for ethical health informatics practices. They empower patients, protect their rights, and demonstrate commitment to transparency and accountability in managing sensitive health information. Ongoing communication, policy review, and staff education are vital to uphold these principles. Thank you.